Hello, and welcome to the Kink Perspective. My name's Chris. I'm a psychotherapist and consultant. On this episode, I want to talk today about sadism. Specifically, the two different types that we get kind of confused, or the terminology that's thrown around within the BDSM community, and it kind of gets a little bit confusing when we talk about being a sadist or being sadistic in the form of play or during a scene or at an event giving a demonstration with someone that you are close to and in a dynamic with, versus having sexual sadism disorder. Now, while they're not completely too radically different and they share characteristics between the two, there are some differentiations between being a sexual sadist or being a sadist or somebody who has a disorder. So first, I would like to start with the disorder itself. It's typically characterized by taking sexual pleasure from humiliating or creating fear, tormenting, or inflicting intentional mental harm on someone else. The sadist alone then acts maybe to use some sort of like a restraint, handcuffs, chains, scarves, duct tape. They might imprison them, bite them. They might draw blood. They might whip them, beat them. When somebody repeatedly practices these sexual sadistic acts, and here comes the caveat, without consent from the person they're with, or when that person is fantasizing or they have these behaviors that start to cause social, professional, or other functional or familial problems, sexual sadism disorder could be a possible diagnosis. Now, I know what you're thinking. Hey, I'm listening to these things. These are some of the things that I take part in. I really enjoy doing them. Well, I hear you. I'm there with you as also being one that is a sadist themselves. And I know that's an oxymoron as far as being a therapist, but the reality is I am still part of the community and we like what we like. But moving forward, when we start to look at extreme sexual sadists, this is when it starts getting into the realm of criminality. It can lead to a lot of serious harm. It's been linked to murders and deaths. Sexual sadism disorder falls under the category of a paraphilic disorder, so a sexual disorder. And when we really start to break it down, we look at the different levels and phases of it, the sexual interest, a person's preferences, their fantasies, and how intense they are, if they have, what kind of urges they're having. The behaviors that they exhibit are usually atypical. Their interests, their preferences, the way someone's acting, these all kind of start to formulate the symptoms of the disorder itself. Now, if they become acted upon, especially in ways that could cause distress and harm to somebody else, to themselves, because sexual sadists, more often than not, begin their experimentation on themselves. Again, when they're starting to branch out and doing this with somebody else, this is when they're doing it who has not given their consent. And it's funny when we start talking about consent in the non-kink world or the vanilla world, because consent isn't a word where we kind of live it and breathe it every moment of the day. When we are talking about the fetish community, everything we do, exchanging a photograph, getting involved in a scene, spanking somebody, we've pre-negotiated these things where consent has been given. Now, healthy sexual activity can include a wide array of these behaviors, and we know this from being within the community itself. Now, we know being within the community, the things that we start to do, the roles that we migrate towards, dominant, submissive, daddy, little girl, baby boy, so on and so forth. When we get into the realm of sadists and masochists, so usually the counterpart to the sadist, what we do know with sadists, at least within our community, that there's no dissatisfaction within the relationship itself. There's no unhappiness. And I'm not talking about minor arguments or disagreements. I'm talking about the satisfaction that comes that when they're involved in that scene or when they're involved in that type of play, right? We know that when we engage in all of these things, that we're drawn closer, those levels of trust trust, that foundation has been built, so we are increasing these levels of tolerance of inflicting pain and for those on the receiving end. The emotional safety that comes from within the community as well. We're able to explore this in a safe manner, right? We've set up and we have parameters in place. We talk about aftercare all the time. We talk about those, I mentioned this before, negotiating what the scene's going to look like. We might even talk what tools we're going to use for the scene. Some sadists will just explain to their submissives or slaves, this is the scene that's going to go down, you're going to be tied up, and we're going to go through a spanking, paddling, and flogging scene without knowing what type of implements the sadist may use. As the scene intensifies, they may derive more pleasure from bruising, drawing blood, so on and so forth. As we dive deeper, though, and we look at the symptomology of being able to diagnose somebody with a disorder, so sexual sadism disorder, the person who is experiencing this, first off, these feelings must be persistent. They have to be intense. They have to be gaining arousal, or they have to have fantasies consistent of inflicting physical or mental harm towards someone else with their consent, but more often than not, without their consent. Now that's kind of tricky there when we think about this. What do we mean when they may grant their consent? So a masochist might agree to a beating, sure. They might agree to a spanking, but then all of a sudden they're getting flogged or whipped with a belt, so their consent has now been violated. When we look at the symptomology here, we're at a bare minimum of 6 months, so somebody has to be having this symptomology for at least 6 months or longer. It's causing them so much distress in their everyday life that they're dysfunctional on social levels. Their professional life is interrupted, or they may not have one. They're not even able to hold a job. Another significant area that's completely impacted is a person's day-to-day daily activities and their routine. This is exacerbated when we start looking at antisocial behavior, right? They don't have a lot of impulse control. They're constantly lying. They don't really care how you feel. They don't really feel that much about anything. And if they've inflicted any hurt or they've harmed you in any way, there's not even an apology. Sexual sadists can be really dangerous and difficult. It's quite difficult to treat, so it does require a specialist. We start getting to the point where we're looking at clinicians to start doing this work. So how do we differentiate them between the disorder and what we like in the BDSM community? Well, we know that obviously with the infliction from a sadist to, more often than not, someone who's at least exploring their masochistic side, we have that love, that trust, those healthy communications and boundaries and negotiations that are respected towards one another. The problem is that when we look at the studies that surround all of the disorder itself, pardon me, that 30 to 40% of people, well, the number is actually growing now, about 60% of the people globally have had started to involve themselves within BDSM type activities, role-playing, choking, light spanking, so on and so forth. They still haven't kind of interpreted the roles and have done a deeper dive within the community. There's no real reason, as we all know, that BDSM just popped up a couple of days ago. The history of BDSM, while some track it back as far as Marquis de Sade, as far as him being a sadist and a masochist, we know that in the Kama Sutra, we know that in even ancient Mesopotamia or ancient Italian paintings and pictographs, there are depicted scenes of extreme sexual activities with people tied up or people put on what we would consider a torture rack device, but they weren't being tortured, they were being sexually tortured. Now, obviously that's a little bit open for interpretation. So here's when we start to see the trend of moving away from the pleasurable side, the consent-giving side of sadism, to the side of it being more geared towards a dysfunction or disorder in which someone's going to need help. those engaging in these activities that are taking part in extreme, well, not even necessarily extreme sadistic practices between somebody, their behaviors, the dysfunction on a social level, a family level, a familial friendship level, or professional level, they're now being consumed with obsessive thoughts. So they're constantly thinking about engaging in these activities when they've seen imagery of somebody being tortured or beaten. This is causing arousal all the time. And as these thoughts, they obsess over these thoughts, they become a compulsion. Interestingly enough, comes with this overwhelming anxiety, stress, sometimes shame, depression, guilt. So the next question that I got was kind of a great series of questions that I had received on this topic was, is sexual sadism disorder common? Is it something highly diagnosed? Well, for that, I started checking in. I looked at sources of the APA, the American Psychological Association. I looked at the European Psychological Association. The prevalence of the disorder itself, frankly, is unknown. The reason why is because, for the most part, people have to self-report to their therapist. From there, they move on to some psychometric testing. The prevalence from global statistics comes in, and it's a wide berth on this one, as low as 2% and as high as 30%. The reason why there's such a range is because then when certain activities are happening, the problem is that initially some of the forensic psychologists can even misdiagnose someone. But at this point, then we've already put them into this category, and it's kind of hard at that point to kind of remove them because they're stuck there. The sexual assault that happened, or even something like a sexually motivated homicide, it may not have stemmed from the disorder, but then they ended up classifying that way. So, like I said, how do we figure out if this is what we're suffering from? Well, it's really important to understand that there's a huge difference between the tendencies of your sexual deviancy on the sadistic side versus being interested in BDSM, the community, and how that excites you. The pathological sense with sexual sadism being the disorder is that you have to understand first, like I said before, you're going to go in, you grab these tests. The first test is known as the Severe Sexual Sadism Scale. And what this does is it physically measures your sadistic urges by looking at arousal levels through audio or even imagery, or a combination of the two, of different sexual behaviors that are being presented to you, with the victim's consent, without the victim's consent, with the people that you're watching, if they're using, some sort of bondage equipment. And the bigger caveat in this testing is the level of violence that is getting measured here. So ultimately, I don't think everybody walking around the fetish community are a bunch of sexual sadists. I do see a lot of terminology, places like fetish.com, alt.com, and their blogging areas, FetLife. People throw these terms around. You're a sexual sadist, you should be committed. Well, I understand that people demonstrate tendencies. They might demonstrate personality traits. I recently talked about narcissism, throwing that terminology around. The reality is these narcissists, people that have sexual sadism disorder, is quite low. If we go on the low end, for narcissists, it's something like 1 to 2% of the total global population. Now, yes, among 8 billion people, that is a lot of people. But the reality is that's spread around the planet. So running into one, those figures are quite low. That's not to say that it's not terrible for the victims that encounter these people. But the reality is your chances aren't great. Now, when we're looking at sexual sadists, you'll start to notice with inside of your partner, not only are they fantasizing, let's just say you're getting involved, you're a masochist, and you think you're involved with a sexual sadist or somebody suffering from this disorder. The reality is that you're going to start to notice a change in their drive and their behavior. They're going to want to increase the levels of pain that they're inflicting. Even if you're starting to agree, and even if you're a masochist, and even if you enjoy it, they're starting to get more and more intense. The levels they're talking about going, you're no longer finding comfortable. They start using the terminology around manipulation to tell you either go along with them and they'll find somebody else. So sometimes in our own needs, we are even helping them along, right? We become the enablers of that behavior. It's not, and people will have to tell me, oh, well, that's victim shaming. It's not, because when we tend to be with somebody, especially when we really enjoy their company or we are in a committed relationship, the last thing we want it to do is feel like we're the reason for them leaving because we can't fulfill their desire. So unknowingly, we enable that behavior even further. The reality is, if we enable it or not, if we continue, caving in and giving into their desires, it becomes unquenchable, especially as the levels start to grow. Is there a level where it starts? Was a really valid question that was put forth. No, I don't really know the difference as far as specifics of if it starts early in childhood, if it's an adolescence thing. Again, the information is not completely clear and forthcoming. The reason, again, for this is because the majority of the time we have to rely on people coming in, self-reporting, they've taken a diagnostic and are concerned, and then they go through a clinician and start taking another battery of psychometric testing. Now, I'm a sadist. I enjoy inflicting pain. There are times I think about scenes, but that time when I'm about to engage with my submissive and when I am about to move forward and we are going to set it up, and for the most part, she knows what's going to happen. There's not every detail is shared because that elevates the levels of excitement. Once the scene is over for me and everything, we've gone through the aftercare process and we have moved on, I don't continually think about the scene. I've enjoyed my time and I move forward. I might think about the scene, the build up a few days before or even a week before. So I'm not caught up in the same trajectory. I have recently, I spoke at an event a couple of weeks ago where I was talking about relationships and a completely different subject, but I found a really interesting group of people that were involved in the sadistic side of the community. And I had found, as we shared our stories, you could feel this kind of primal surge between all of us. And it was men and women alike. The infliction, that power exchange, the power of control over somebody else, especially when they are now restrained or they are helpless against your advances. We all know in the realm of reality that we're not going to get to the point where we are inflicting so much harm that we are going to, disable someone, that we're going to make it so one of their limbs is cut off. There becomes a fine line. It's clear and distinct. So those limits are predefined. It's very rare, though, when or at least in my encounters, that I've ever experienced anyone coming along and saying, you know what, I have no empathy if she got hurt, or, I was stepping on his balls with my boot and I didn't care when I heard the testicles crack, right? I've yet to encounter anybody like this personally. I'm not saying that they don't exist, but, we have to understand that this driven desire for this feeling and power doesn't get too diluted between the two. Because even though we're adding in the sexual component of the pleasure, right, that we see in the general population of the BDSM community, where we run around with this fetish and we understand that one side of and not everybody is a sadist either. And I need to make that clear. Sadism is kind of like, I would even say, with the DDLG community, so the daddy dom little girl community, you kind of gravitate towards things that you have a proclivity to. I know there are some that are daddy doms, primals, sadists, masters. For me, that's one too many hats. I tend to focus on one avenue of the lifestyle that I really enjoy, and I focus on it. And I know other dominants do as well. But when we start moving into the point that the pain inflicted upon others, there's a response neurobiologically deep in the amygdala, right? So there's been studies on this. They've done MRI scans that higher levels of pain that they're starting to inflict compared to those in a control group that were not sadistic. These images showed higher concentrations of activity in this part of the brain compared to those who did not enjoy these activities. It's just interesting to note how the brain works, what areas are lighting up. What we do understand is that, and another major interest or differentiated area between somebody with the disorder and somebody who doesn't, or even a non-sadist at that, is that the area of the part of our brain that's our pain processing center tends to be more active than that in the control group of non-sadists, people that are viewing this imagery and how they're responding. So when we look at all of these factors, we start considering what are the treatments, is there a cure? Well, the reality is that the majority of the people that have been found guilty of this, that are suffering from this or have been involved in a criminal activity and then they're also diagnosed with this, they have to get professional help. They have to seek a clinical psychologist. They're seeing probably a psychiatrist as well, who not only are performing these evaluations, but they're doing treatment, which is not only coupled with psychotherapy like what I do, but then they also are including medications. Will form on a basis of usually cognitive behavior therapy. We'll start to recognize and look at their patterns of arousal and find healthier responses to help them curb the urges. Because the urges are always going to be there, then we have to look at new ways for them to challenge and change the urges that they're encountering and put that energy into something else. So we kind of look at a restructuring process of their thought processes that as they move forward, right? This is where even medications come in to help. Ultimately, pharmacology, behavioral science, ways to help us deal with, so usually they'll put somebody on a antidepressant, or even sometimes they'll put somebody on a testosterone blocker, can help reduce these urges. They can't completely cure somebody. That becomes the problem. Also, we can't control, unless they are criminally charged, you can't control people from going out and around others. I'm not saying that everybody we are encountering within the BDSM community is a sexual sadist, let alone suffers from this disorder. Again, it's quite rare. Globally, it's quite rare. Within our community, it's going to be rare. Not every dominant that comes here that claims that they're a sadist is actually, in fact, a sadist. As I was talking with somebody the other day, I had mentioned I think sadism comes in levels. There's the standard sadist that loves to spank somebody and might use a belt. Then there's the level 2 that's using, implements, the flogger, maybe a whip or a crop, and it goes up from there until you get to the high level sadists that are becoming so ingenious at inflicting pain, it almost becomes artistic. There is one or two that come to mind, especially there is a lovely couple that I know that up in Canada he is a sadist and she is his masochist. Hopefully one of these days I'll get him on the show, and I'd love to have a conversation about all these wonderful topics with them. Are your chances of running into somebody who says they're a sadist suffering from this disorder? watch out. Make sure you have consent. Make sure you're negotiating everything. Make sure you have your safe words. Make sure you're being respected. Test all of these limitations before you get involved. Think about the risks that are at hand that you might encounter if you're going to get into an activity. Make sure that they're safely trained. Maybe the first time you're doing a scene with somebody new that claims to be a sadist, do it in an area where there's somebody else. Perform it at a club. If you're both more insistent on remaining private, maybe have another couple there that you both know so you can feel comfortable. And one other thing I want to always mention as well, when we start talking about safety and security, unfortunately when we talk about I'm going to make sure you feel safe, I'm going to protect you and all of these things, the concept of safety itself, when it comes to even sexual activity or the BDSM community, the concept of safety is something that only exists in your mind. You can't hold safety in your hands. So take all the precautions you need to feel safe, to be in the least risk-filled environment when you're playing with someone new, until you can start building those levels of trust and comfortability where you're no longer having to rely on the word safe to get you out of a situation because they're already going to have your best interests at heart. It's a lot to think about. It's a lot to consider. And like I said, there's not people running around with the disorder rampant through the community. Or at least not that I've encountered in about 3 different continents on 15 different countries. Until next time, everybody, be safe and stay kinky.